Pnawn da, Eluned Morgan, dwi, Gweinidog, Iechyd a Gwasanaethau Cymdeithasol Llywodraeth Cymru. A heddiw, wrth i'r Gwasanaeth Iechyd ddathlu 73 o flynyddoedd, yn ymuno â mi, mae Dr Andrew Goodall, Prif Weithredwr Gwasanaeth Iechyd Genedlaethol Cymru. Mae heddiw yn gyfre arall i ddiolchu'n staff iechyd a gofal cymdeithasol am y gwaith anhygol y maen nhw wedi wneud trwy gydol y flwyddyn i ofalu am bob un ohono ni. I ni'n rhoi ffydd enfawr yn ein gwasanaethau iechyd a gofal ac yn ymddiried ynddyn nhw. Maen nhw bob amser yna i ni pan fyddwn ni eu hangen, yn enwedig dros y misoedd diwethaf yma. I'm Eluned Morgan, the Minister for Health and Social Services, and today, as the NHS celebrates 73 years of existence, I'm joined by Dr Andrew Goodall, Chief Executive of the NHS in Wales. And this is an opportunity to once again thank all our health and social care staff for the work they do every day of the year to care for each and every one of us. Now, we put enormous faith and trust in our health and care services, and they're always there for us in our time of need, especially over the past few months. And I echo Nye Bevan's words, the NHS will last as long as there are folk left with faith to fight for it. And I want to give you an assurance that the Welsh Labour Government will continue to fight for the NHS and all the amazing people who work in it. Now, Nye was a son of Wales, the model he saw working so well in Tredegar Medical Aid Society led to the development of the National Health Service, a healthcare system which continues to inspire people around the world. Diolch yn fawr iawn I bob un ohonoch chi am bopeth I chi di wneud drosto ni. Thank you very much for everything you continue to do for us all. But today is a particularly special day for the NHS, and I am incredibly proud to share in the joy of announcing that NHS Wales, together with the other 3 national health services in the UK, has been awarded the George Cross in recognition of the incredible efforts it's made every day over its long history, but especially during the pandemic. Andrew, as the head of the NHS in Wales, would you like to respond to this award?
Diolch, Gweinidog, thank you. Minister, this award is unprecedented but truly deserved. The tens of thousands of NHS staff working in our communities and our hospitals across Wales show real strength, passion, professionalism and dedication in their work every day. They are the heartbeat of our health service. We are rightly proud of our NHS. It is our most valued public service. And the pandemic has shown just why we hold the service in such high regard. The last 16 months have been very difficult for the health service right across the UK. The service has been put under incredible pressure as a result of the high numbers of people falling seriously ill with COVID. We have had more than 31,000 COVID-related hospital admissions in Wales since March 2020. And this has been an illness unlike any other. People have needed intensive support in hospital, often for a very long time. And very sadly, too many people have died. Coronavirus has really tested the NHS and all those working for it. We have asked a huge amount of our NHS staff, and they have delivered through some very dark times. The NHS has also been at the forefront of delivering the vaccination programme, helping to protect us all against the virus, and I know the Minister will say more about this in a moment. We have a lot of exhausted staff in the NHS now after the experiences of the last 16 months. They have shouldered enormous physical and emotional demands, and we are about to ask even more of them and the NHS. There is very little opportunity for the NHS to stop to catch its breath and recover from the impact of the pandemic. At the end of last week, 86% of all hospital beds were full, but the vast majority were not COVID-related. Demand for urgent and emergency care is back to pre-pandemic levels, and at times it is even busier. Delivering this level of care while we still have strict infection control and social distancing measures in place to protect staff and patients from coronavirus is difficult, and it means the productivity and efficiency of the NHS is affected. In primary care, more and more services are being provided. NHS dentists are bringing more people forward for routine treatment. and in some parts of the system, demand and activity is higher than it was before the pandemic. All this while coronavirus has not gone away. I will hand back to the Minister, who will explain more about the current public health situation.
Diolch yn fawr, Andrew. A fel dwedodd Andrew, dydy coronavirus ddim wedi diflannu. Mae'n dal I fod gyda ni. A diolch i'r amrywiolyn Delta, mae achosion wedi bod yn cynyddu ac yn lledaenu yn ein cymunedau unwaith eto. As Andrew said, coronavirus has not gone away. It's very much with us. And thanks to the Delta variant, we've seen cases rising and spreading in our communities again. Now, this slide shows you what has happened over the course of this year. You can see the peak of cases over the winter and how they've fallen steadily during the spring, thanks to all your hard work. Cases were at their lowest in May, but the emergence of the Delta variant has sent cases rising again, especially in North Wales, where we're once again seeing very high levels of infections in the community. Overall, we have a case rate of 95 cases per 100,000 people in Wales, and more people are coming forward for testing every day. Now, Wales is not alone in seeing rising numbers of cases once again. We're still a couple of weeks behind what's happening in England and in Scotland. And the World Health Organization has warned about a new coronavirus wave in mainland Europe, as the number of new infections has increased for the first time in 10 weeks. Now, we're increasingly confident this wave will not cause the same level of serious illness and harm as the previous waves we've experienced in Wales. And this is thanks in large part to our fantastic vaccination programme, which has been delivered by the NHS. And I'll say more about this in a minute. Now, this slide shows you what's been happening with hospitalizations and COVID. And you can see at the start of the year, when cases were high in the community, the number of people in hospital with COVID was also high. It's taken a long time for the numbers of people with COVID in hospital to come down because so many people have needed to be in hospital for a long time, in some cases up to 3 months or more. Now, unlike the last slide, which shows cases going up again in the last few weeks, hospitalizations for COVID have been below 100. Now, in the last few days, there's been a small increase in the number of people admitted to hospital with COVID. There are around 100 people with COVID in hospital at the moment, and we're watching these numbers very carefully. But we believe vaccination has weakened the link between the virus and hospitalization, even in the face of the new Delta variant. Now, this doesn't mean that you're invincible if you've had 2 doses of the vaccine, but it does mean it's really important that you complete the course. 1 dose is not enough. Now, we're making really good progress in Wales. Our vaccination rates are still the best in the UK and amongst the best in the world. Almost 9 out of 10 adults have now had their first vaccine, and 2/3 of people have been double vaccinated. But we want to make sure that no one is left behind, especially younger adults. So please say yes to the vaccine. It's not too late to have the jab. I ni eisiau gwneud yn siŵr nad oes neb yn cael ei gadael ar ôl, yn enwedig oedolion ifanc. Felly, please manteisiwch ar gael y frechlyn. Dwi ddim yn rhy hwyr I gael eich pigiad. If you've been vaccinated, don't forget that all the other measures which keep you safe and others safe are important to continue with. Keeping your distance, washing your hands, wearing a face covering in indoor public places, keeping indoor places well ventilated, and working from home wherever possible. Diolch yn fawr I chi gyd. Now, Andrew and I will take questions from journalists, and all the answers will be broadcast on our social media channels. Si'n dechrau gyda Owain Clark, BBC Wales.
Pranawn da, good afternoon. A question to you both, but could I ask Gweinidog I ymateb yn Gymraeg hefyd os gwelwch yn da? Given the concern you mentioned about rising numbers of infections, but even so, the good news that they're not translating into a lot of hospitalizations as things stand. And given what you, Dr. Goodall, talk about the NHS not having been able to take a breath, do you both, as the people in charge of NHS Wales, agree with the messaging coming out of Westminster about the easing of restrictions potentially in the next few weeks? In other words, should the vast majority of remaining restrictions be eased in Wales over the next few weeks?
Well, diolch yn fawr, Owen. If I start, Andrew, and come on to you. We are very clear that we are still in a very difficult situation because the case numbers are increasing exponentially still in Wales. So especially those people who haven't been vaccinated, there's a real vulnerability for those people. Now, having said that, because we're seeing a weakening of that link, then we also have to understand that there are other harms that we need to consider. And in particular, the mental health situation, the economic situation, the social situations that people find themselves in. All of these things now need to put into the mix. And we'll be considering those in the next few days. You're aware that we have a regular 21-day review system. We will be making recommendations, therefore, next week on that cycle. And we will, of course, as always in Wales, be following the data rather than following the politics. That is what we've been doing all the way through this, and we will continue to do that. Our primary concern is to try and keep people safe, but of course, we need to understand that we are going to learn to live with this illness, and we are going to have to adapt as a society to a situation where we will be exposed to an extent to this new variant and to coronavirus more generally. Andrew.
The NHS, Owain, has been through various phases, from preparation to the immediate response to a focus on essential services, and then a real wish to be restoring and recovering activity for the NHS at a time when we know that we have seen different levels of coronavirus within the communities. And I think those phases really show how important it is to make sure that the NHS continues to need to expand out its activity. If I was comparing where we were during the first wave and the activity for planned care, for example, that we are undertaking in our system at the moment, it's probably tripled. So we are making progress, but we still remain short on those numbers. What is really clear to me is that we have already seen a recovery of emergency activity within our system, which is either at normal levels or at times actually higher than that. We've seen a recovery of our outpatient referral numbers and a recovery of our cancer referrals. The important thing for us to really track and monitor within the NHS has actually been not just the community prevalence as that first trigger, but actually the way in which beds are occupied by coronavirus patients. And our latest figures, as the Minister was saying earlier, show that last Friday there were 104 patients in our hospital beds across Wales, and that remains at the very lowest end of patients who have been in beds for coronavirus reasons. At our peak, we were close to 3,000. So I do think that it's the hospitalizations that probably is the key trigger for us, because that will be demonstrating that we have managed to show that there are less seriously ill patients within our community. But what we need to do is to still have a context whereby the NHS is able to still point its services in a normal direction and to continue to recover our activity.
Diolch, Owain, jyst i ymateb yn Gymraeg. I ni'n ymwybodol bod lefelau coronavirus yn uchel iawn yn cymunedau ni ar hyn o bryd ac yn dal I godi. Ond I ni falch iawn I weld bod yna lleihad o ran cysylltiad rhwng cael Covid a nifer o bobl sy'n mynd mewn i'n ysbytau ni. Chi'n ymwybodol pob 21 diwrnod I ni yn neud asesiad o'r sefyllfa, I ni'n neud yr asesiad yna ar sail data ac nid ar sail gwleidyddiaeth, a dyna beth fyddwn ni'n neud yn y dyfodol hefyd. Mae rhaid ni ystyried bod lot o ffactorau I ystyried, nid just coronavirus, mae yna ffactorau economaidd, mae yna ffactorau fel iechyd meddwl, ac felly bydd rhain I gyd yn cael ei ystyried yn ystod yr wythnosau nesaf. Fel mae Andrew Goodall newydd dweud hefyd I ni'n ymwybodol iawn fod y gwaith sydd angen I wneud yn ysbytau ni yn gorfod symud nôl I trin pobl sydd â problemau eraill hefyd, ac I ni'n falch iawn I weld bod yna lleihad yn y nifer o bobl sydd yn mynd mewn i'n ysbytau ni.
Diolch yn fawr iawn. Again, a question for both ac ymateb yn y Gymraeg unwaith eto sy'n bosib. Many will welcome the very important recognition the NHS across the UK has had today for its work during the pandemic and beyond. But many would argue that the very best recognition staff would have and would get would be a decent pay rise, to be offered a decent pay rise after all their hard work. Could you tell us the latest about the process? What is the Welsh Government's thinking about what staff should be offered, and when will NHS staff know?
Well, we are very pleased that we were able to recognise, first of all, the work of our health and care staff through awarding them a pay bonus during the year. But we recognise also that they deserve a pay rise. I am waiting for advice from my officials on the situation in relation to payments for staff next year and for this financial year as well. That will be a decision that will be made in the next few weeks. And so we are waiting, I'm waiting for that, but it shouldn't be too long in the future. What I can say is that we have made it clear as a government that we didn't want to see a cap, as was imposed by the Conservative government in England, that they didn't want to see more than 1%. That is not our situation in terms of the Welsh Government, but we wait to hear that advice.
I'm very proud of our NHS staff and the way in which they have responded through the pandemic response. Obviously, the George Cross also recognises the 73 years of the NHS and the contribution that it has made more broadly. I think it's always been really important, Owain, to be realistic, however, about the pressures that are faced by our NHS staff, and I hope that even through these press conferences it's been a way of making sure that there is some recognition of the individual pressure that clinical teams have felt during this, because their focus has been always on doing the right thing for the Welsh population. I would, however, say that, and I know this would be true of our NHS staff, that they would also want to recognise the contribution, of course, that has happened from social care colleagues, from key workers and from volunteers. And the thing I would really like to emphasise is the important role that the public have also played alongside us in this response. But very proud to see that recognition of the George Cross for the NHS in Wales today.
Just i ymateb yn Gymraeg, ni'n falch iawn ein bod ni wedi gallu cydnabod y gwaith aruthrol sydd wedi cael ei wneud gan gweithwyr iechyd a chymdeithasol ni dros y blwyddyn diwetha trwy roi bonus iddyn ni. Ond dyn ni hefyd yn ymwybodol fod angen gwneud cyhoeddiad ar y cynnydd mewn cyflog yn ystod yr wythnosau nesaf. Dwi yn aros am gyngor oddi wrth yn swyddogion ni ar y mater yma, a dwi'n gobeithio fyddwn ni'n gallu gwneud cyhoeddiad yn ystod yr wythnosau nesaf. Owain Phillips, ITV Wales.
Minister, can I ask some non-COVID related health questions and ask you about proposals for a new cancer centre in the north of Cardiff? Given the First Minister's renewed focus on the environment, do you still support the building of a new cancer centre on a greenfield site?
Thanks very much, Owain. Yes, I very much support the development of the new cancer centre in the Whitchurch area. Of course, we do need to be sensitive to the environment, but what is important is to recognise that there is a huge amount of support amongst, in particular, those who have received care in Felindre in the past. What is important, I think, is that we focus on the needs of those who are suffering from cancer at the moment, and putting in place the modern equipment, the modern facilities that will be needed. Andrew, could you, anything to add on that?
No, Minister, the approval process has gone through at this stage, and Felindre NHS Trust are responding to those criteria and any concerns that have been expressed.
Minister, 163 medics wrote to the Welsh Government saying a standalone cancer centre is the wrong approach and that it should be next to an acute hospital. What do you say to those doctors?
Well, thanks very much. I'm aware of that letter that's come from the medics. I think what we've got to understand is that there is a time pressure here that we do need to get on with the job of creating a new facility very quickly. We do understand that that there are recommendations that sometimes, if possible, you need to put those near each other, but we are not talking about facilities that are a huge distance away from each other, and I think that's why we have progressed with this decision.
Yeah.
Rebecca Miles, LBC.
Diolch, Gweinidog. If I could get your answers in English and then in Welsh, please. First of all, really, as we're expecting Boris Johnson to ease rules and scrap rules around face coverings and social distancing, are they fair to the people in Wales, with so many people living their lives on both sides of the border for work or for school? And have there been any conversations between the devolved nations about moving forward on a united approach?
Well, thanks very much. Boris Johnson will do what he thinks is right for England, and we will do what's right for us here in Wales. We've done that throughout the pandemic. We've responded to local circumstances, and we will continue to do that. And we will be driven by the data, as I've mentioned earlier, not by any political deadline that has been set out artificially, which time and time again in England has been set and then missed. So we're not going down that route. We are, of course, aware that there is a huge amount of movement across our borders. We do have a very constant dialogue with representatives of the UK government. And of course, in an ideal world, we would like to move together. But if it's not right for Wales, we won't be doing that. But as I say, we will be making those decisions in our next 21-day review. So I'm afraid you'll have to wait, probably, I think, until next Wednesday. We're hoping to make some further announcements on that next week. Chos fi ateb yn Gymraeg, newn ni wneud y peth gorau I ni yma yng Nghymru, achos dyna I ni wedi wneud trwy gydol y pandemig. Mae'r hyn maen nhw'n penderfynu yn Lloegr sy'n iawn iddyn nhw, mae hwnna'n dibynnu ar ei gwleidyddiaeth nhw. Yma I ni wedi bod yn dilyn y data, mi fyddwn ni yn parhau I ddilyn y data. Ni'n ymwybodol bod yna lot o symudiad ar hyd y ffin rhwng Cymru a Lloegr, ond wrth gwrs I ni yn cael trafodaethau yn aml gyda y gweinidogion o Llywodraeth Pryden, ac mi fyddwn ni'n parhau I wneud hynny. Ond fe fyddwn ni'n wneud cyhoeddiad ar hwn yn y dyddiau nesaf, falle dydd Mercher nesaf, ni'n gobeithio wneud cyhoeddiad yna.
Thank you. And just another question for the Minister, please. You've said today that coronavirus has not gone away. It's a virus we're going to have to learn to live with. If we move more towards guidance rather than strict rules, can you rule out that we might, whether or not we'll have to go back into another lockdown in winter, where our NHS usually deals with much tougher pressures?
Well, thanks, Rebecca. We will have to learn to live with this virus, and what I won't give you is any assurances that this is the end of the road. We don't know. There may be a new variant that escapes our vaccines, so I can't make those kind of predictions. I'm surprised the UK government is able to make them, but certainly here in Wales, we will not be giving those kind of assurances that there won't be any lockdowns in future. Of course, we will avoid them if we possibly can. We are also aware that the chances are that there will be huge winter pressures this year because of possible flu outbreaks, which what we've seen is that the chances are that there will be very high rates of flu this winter. The NHS, I'm pleased to say, has already put measures in place to prepare for that. But we will have to learn to live with this virus. But of course, we will be putting very clear guidance in place. But at some point, of course, people will have to make their own judgment and their own decisions about the risks that they will need to take. But we will be giving some clear guidance on these things, and that will come up in the 21-day review. I don't know if you've got anything to add, Andrew?
Whatever we would normally plan for a winter period, we absolutely need to enhance it. And the Minister is right that there are a number of other normal experiences through the winter that probably have been deferred just because of the nature of the coronavirus pandemic. And we are watching what happens in the Southern Hemisphere, in particular in respect of the access to their hospital services at the moment. Having said that, it's really important that the NHS, however, does plan, and we are ensuring that the NHS is planning for a much higher degree of bed capacity, for example, even of critical care flexibility for this winter, so that we can deal with some of the inevitable peaks and troughs that happen. But I think one of our other underlying assumptions as well is as much as possible to be retaining still a range of our normal services that we've been trying to recover over recent months as well. So it's a very difficult equation, but we are trying to plan for a number of different scenarios, but extra capacity for the NHS is actually part of those.
Adam Hale, PA.
Good afternoon to both. UK government seems to be fairly confident it's seen enough information or evidence to be able to scrap restrictions in England later this month. Has the Welsh government mandated to see this information, or perhaps has the request been ignored or declined? Because surely time is of the essence if that information is available and rules can be changed here.
Thanks very much, Adam. We, of course, are analysing the data that is coming from England and Scotland, indeed, and we are monitoring the situation there, in particular when it comes to hospital beds and what's happening in relation to the number of people being hospitalised as a result of COVID. We, of course, have our own data that we're also analysing. It looks like we're about 2 weeks behind what is happening in England and in Scotland. But that data is being crunched as we speak. We will be making those announcements in our next 21-day review, and as I suggest, that will be based on data. Adam?
Yes, we are also several weeks ahead on the vaccination programme, so we are looking to see to what extent that may give Wales a greater degree of protection as well. But through our scientific groups that are in place, we obviously make sure that there are discussions that take place between the UK mechanisms and what's happening in Wales. So yes, there is available data behind the scenes, but actually much of this information to actually track the position for both England and Scotland is in the public domain pretty speedily as well. So we're probably all monitoring that data together.
And just to add, I think it's probably worth saying that the more restrictions are released at a time when we have an increasing number of cases, the more vulnerable those people are who haven't received the vaccine. And so I would ask people to take up that opportunity, because the more we release restrictions, the more vulnerable those people are. And that's why their biggest protection, their best protection, is the vaccine. But at some point, we are going to have to release these restrictions. So I would urge people to take this opportunity. And of course, we had walk-in centres over the weekend where anybody could go. It is still possible for you to take that opportunity to have the vaccine.
The government was quizzed at these press briefings for months about the use of face masks. Ministers were saying for some time there was no evidence they would have a significant benefit until that stance later changed. Given the reluctance to impose the requirement, could we expect to see mask rules being lifted before the other major restrictions here, social distancing, and if so, when would that likely be?
Well, we still have to make the call on these kind of issues. I think we've got to remember that face masks, they're not just to protect yourself, but actually to protect others. And so when we're in a situation where we are alongside other people, you can just imagine trains, for example, we're in crowded spaces, then we do need to consider very carefully at what point we would allow people not to wear masks under those circumstances. Anything else to add? Okay, Gwyn Loader.
Pnawn da. Na I ofyn y cwestiwn yn Gymraeg gyntaf I chi'r Gweinidog, and I'll translate in English for you, Dr Goodall. Mae ymchwiliad gan rhaglen newyddion S4C wedi canfod bod 1 o bob 4 marwolaeth Covid yng Nghymru yn deillio o heintiadau mewn ysbytau. Mewn 2 fwrdd iechyd, mae'r raddfa hun yn ucha, mae'n 1 o bob 3. Allai ofyn am eich ymateb I hynny, ac ydych chi am wneud unrhyw beth I edrych yn bellach ar beth yw'r achosion. Dr Goodall, I just asked the Minister, after an investigation by newyddion S4C, we have discovered that almost 1 in 4 COVID deaths in Wales stem from hospital onset infection in 2 health board areas. That's 1 in 3. I'd just like to have your reaction to those figures, and whether you're doing anything to investigate and to drill down into why they were considerably worse in those 2 health board areas specifically.
Minister, if I just start and give me your reflections. We have tracked the implications of high community cases into the hospital system right through from the very start, and our knowledge has changed. We've tried to make sure that even for an NHS with very clear infection control policies in place, that there has been a need to adapt the guidance that is available and make sure that it is very targeted at the particular risks associated with coronavirus. And we have constantly through the year, learning with colleagues across the UK, changed our guidance to make sure that there would be as few hospital transmissions as possible. There are some difficulties in how we see these things grab very quickly the environments in the healthcare environments. If there is high community prevalence, inevitably we will see that reflected in both patients and of course potentially in staff in there, which is why we are even at this stage continuing to retain all of that protection. For any death that has occurred, there is an individual case review process which is in place. That is in part to make sure that those are individual investigations around the circumstances, but they are also to make sure that we learn lessons. And even over recent weeks, all of the group mechanisms in place for guidance on a national basis have continued to meet to make sure that hospitals can continue to learn. Today represents a day where we have been allowing health organisations to determine under a national framework their flexibility for hospital visiting. But I think the figures that you describe brings home some of the underlying concerns to make sure that everything is discharged as safe as possible, because we know that coronavirus just finds any opportunity to exploit weaknesses in the system, even with the best clinical practice, but also with the best infection control practices as well. But we will continue to review those, obviously, as we see community cases increase at this stage.
Just i gyfieithu hynny, Gwyn, I ni wedi bod yn tracio'r cysylltiad rhwng yr haint sydd yn y gymuned a'r haint sydd yn ysbytai. Ac mae'n amlwg bod pobl sydd yn gweithio yn ysbytai hefyd yn rhan o'r gymuned, ac felly mae'n anodd iawn i gadw yr haint allan yn llwyr o'n ysbytai. I ni wedi rhoi canllawiau i ysbytai sicrhau bod pobl yn ofalus iawn wrth nhw ymweld. Wrth gwrs ar y llaw arall, mae lot o bobl wedi bod ar angen mynd i weld pobl i anwyliad nhw, ac felly i ni wedi gofyn i'r ysbytai i gymryd pob i edrych ar beth sy'n digwydd yn eu cymunedau nhw'n lleol o ran ymateb yn lleol, achos mae'n dibynnu ar beth yw lefel yr haint yn yr ysbytai. Ond wrth gwrs, i ni yn dysgu wrth i ni fynd ymlaen, ac i ni'n dysgu'r holl amser gyda'r feirws newydd yma.
Wi wedi siarad gyda meddygon, gyda gwleidyddion o'r gwrthbleidiau a gyda theuluoedd sydd wedi colli anwyliad i'r feirws yma. Yn sgil y wybodaeth i ni wedi dod â'r amlwg nawr, maen nhw'n galw eto am ymchwiliad penodol i Gymru am farwolaethau Covid yn enwedig rheini sy'n deillio o ysbytai. Dwi'n credu mae cwestiwn gwleidyddol yw hwn i'r Gweinidog, a fyddwch chi'n ymgymryd a ymchwiliad o'r fath, Eluned Morgan, a chi'n fod yn ateb yn Saesneg hefyd, os gwelwch yna.
Wel, wrth gwrs i ni yn cydymdeimlo'n fawr gydag unrhyw un sydd wedi colli anwyliad yn ystod y pandemig yma. Wrth gwrs mae'r DG wedi dweud yn glir fod na ymchwiliad mewn i'r pob achos eisoes yn cael ei wneud, ac mi fyddwn ni'n gorfod wneud penderfyniad, ac wrth gwrs fydd na ymchwiliad fwy eang o ran sut i ni wedi delio gyda'r coronavirus, gyda'r ymchwiliad cyhoeddus yna fydd yn digwydd ar draws y Deyrnas Unedig, ac wrth gwrs dwi'n siŵr bydd hwn yn rhan o hynny.
Ac yn Saesneg, please.
Thank you. Of course, we have extreme sympathy with anybody who has lost a loved one during this pandemic, in particular if they have caught that virus in hospital. Of course, it's clear that the staff in our hospitals are also part of our communities, and that community link is never going to go away, and that's why we have put in very clear guidance which suggests that not only should we be careful, but also it's up to each local health board to determine locally, depending on the circumstances in their areas, how they control the people coming into their hospitals. In terms of an inquiry, of course, the Director General has made it clear that every individual case is already researched, but of course there will be a broader inquiry across the United Kingdom, and I'm sure that this will be an issue which is picked up in that broader inquiry. Lily Hewitson, GB News.
Thank you. Firstly, a question for the Minister. When the Economy Minister announced the extra support package for businesses in Wales continuing to be affected by the pandemic last week, he said it was to cover operational costs for July and August, and that this would hopefully be the final package of emergency support needed. Does this mean that Welsh Government aren't looking at easing restrictions entirely until September, and should affected businesses prepare to wait 2 more months to be able to reopen?
Well, we haven't made a final decision on what exactly those restrictions will look like, in particular from mid-July through August. But it's clear that there are businesses that will continue to be impacted, irrespective of where those suggestions land in terms of what we decide in that 21-day review. And that's why it was appropriate for the Economy Minister to set out and to give some comfort to those businesses that irrespective of where that lands, that there will be support in place for them.
Thank you. And a question for Dr. Goodall. Now that more hospital patients will be able to have visitors here in Wales, why couldn't lateral flow tests be used previously to allow loved ones to be reunited? And also, is there a postcode lottery now of people who will be able to have family and friends at their bedsides? And how come we couldn't have a Wales-wide approach with the number of people that people could, have at their bedside while they are in hospital?
Just on your latter point, there is a Wales-wide approach. We've put in a national framework that sets expectations and guidance for the way in which safe hospital visiting can take place. As we have been monitoring ourselves, the data and the figures over these recent months, it's really clear that there are times when individual health board areas will have different pressures. We've seen some of that more recently, for example, with a higher prevalence of cases in North Wales, for example, than we would have seen in perhaps the first and the second wave. And what we've wanted to do in endorsing those guidelines is to make sure that we allow organisations to understand their local circumstances. So whether that is a specific ward environment, whether they need to adapt around a site, or indeed whether they need to discharge some of the broader community settings as well. So the guidance has been welcomed by the NHS because it just allows them to make sure that they are discharging that safely in line with the latest public health advice. What's really important, however, is that we wanted to introduce this guidance to make sure that there would be access and that there were clear circumstances for how families and friends were able to support patients within their hospital stay. But I do hope that people understand that the risks that we have had over these last 16 months have been extreme, and our responsibility has been to protect those who are the most vulnerable, and that will be those who are actually receiving our health and care services in general terms. Speaking on the NHS in general terms and about our approach, it's really important that we continue, I think, to focus on the NHS's day-to-day activities. We have to make sure that there is a public health response, and we also need to make sure that we are reviewing, I think, harm that will be occurring to our population if we're not able to restore some of our general activities. But throughout the pandemic response, we've always tried to balance when we step in with national actions, but when we actually introduce that local support for the individual health organisations across Wales.
Can we go on to Mark Smith, Wales Online?
Thank you very much indeed, both. This is a question for you, Health Minister. England's Education Minister, Gavin Williamson, says he wants to scrap school contact bubbles as soon as possible. And there have been reports that the Welsh Government is considering scrapping them in the next academic year. So my question is the Cabinet planning to end contact bubbles to end the disruption to children's education?
Well, thanks very much, Mark. What we'll do in Wales will be appropriate for Wales, and we won't be following necessarily what they do in England. If they have a good idea, then we'll be more than happy to follow it. But it will be up to the Welsh Education Minister to determine how that works out. I know he's working incredibly hard at the moment to try and get some thoughts in place around these issues, ideally before the end of term, so that people will know what they're coming back to in September. So those contact bubbles, I know there's a huge amount of work being done around that at the moment, to what extent we use test, track and trace, test, trace and protect, but also in terms of face masks. So those will be decisions that will be made in the forthcoming weeks so that people will know what they're coming back to in September.
Thank you very much indeed. And secondly, we've heard reports of groups of people congregating outside hospitals, such as the Royal Glamorgan Hospital in Llantrisant, and the constituency offices of some politicians protesting against the vaccine rollout and current lockdown measures. Their behaviour has been described by some on social media as intimidating. What do you both make of the actions of these people and how perhaps NHS staff in particular could be affected?
Well, the people in the NHS have worked so hard over the past few months, and it is absolutely appropriate that today they are awarded the George Cross. Isn't it ironic that there are some individuals who then take this time to be making the case against them? I think that we should stand by those people who've been absolute heroes during this pandemic. We have had a terrific response in terms of the vaccine rollout in Wales. It is clear that the vast majority of the public stand firmly behind us. The fact that the Welsh Labour Party was returned with a situation where we knew that about 70% of the public are comfortable with the approach we've taken in the pandemic because of that cautious approach. We must not be intimidated. We will not be intimidated, and we must not tolerate intimidation of our health staff.
This pandemic has been very real. I know I speak for NHS staff to say that this will have been the most difficult and challenging time that any of them will have worked through. But of course, this will have been the most challenging period for the NHS over its 73-year history. And the data and the numbers that we've seen are real. It was real when we reported nearly 3,000 patients in our hospitals across Wales. That was approaching nearly 50% of our available bed capacity. And sadly, for those who have passed away during this pandemic response, they are also very real, and they are individuals whose families at the moment have lost loved ones. So I would hope that we can ensure that there is a real focus on the positives about where we are at this stage, because there is a real advantage to take advantage of the vaccination programme, where we are encouraging people to apply at this stage. But NHS staff have been exhausted by the sheer personal commitment that they've put into this response, and I hope that there would be some respect for that in the response that we've made.
Diolch yn fawr i chi gyd.